Hello everyone, today I'll be talking about fasciola, which is famously known as liver fluke. Before I talk about fasciola, I would like to outline the contents of this presentation. First would be on the introduction of fasciola, basically what is fasciola, the types of fasciola, and second would be the pathogenesis and the clinical manifestation of fasciola. Third is the life cycle of fasciola. Fourth is about the laboratory diagnostics of fasciola. Fifth would be about the treatment of fasciola. And sixth is about the preventive and control measures taken to avoid fasciola. Moving on to the introduction, fasciola is a liver fluke, which is a type of parasitic worm that infects the bile and liver duct of exposed people and animals, such as sheep, goat, cattle, and other herbivores, as well as wild animals. Fasciola parasites, this causes infectious disease known as fasciolosis, which is common in people who live or work around livestock. There are two types of fasciola. The first one is Fasciola hepatica. This type of fasciola is also known as the sheep liver fluke, which usually, most commonly, infects people. The second type is Fasciola gigantica. This type of fasciola primarily affects domestic and wild animals, but it can also infect humans as well. The fasciolosis pathogenesis occurs in two phases, the parenchymal and biliary phases. The parenchymal phase begins when the newly excisted juveniles cross the liver capsule, which is known as the Gilson's capsule, continuing with the migration of the juvenile stages through the liver parenchyma. This migration causes mechanical damage through abrasion by the tegumen that presents spines that maintain the parasite's position within the liver tissues, and probably byproducts secreted by migrating larvae. Several pathological processes occur simultaneously within the liver parenchyma, including the migration of juvenile stages that cause necrotic and hemorrhagic lesions, which in turn causes inflammatory reaction activating the immune system. This response can be found throughout the tortuous migrating trajectory of the parasites, suggesting that the secretion and excretion of these products remain in the tissue, attracting more infiltration of inflammatory cells of an immature nature. For the biliary phase, this begins when the parasites enter the bile ducts, where they exert a combined mechanical and chemical action. Through the oral sucker, adult parasites cause mechanical damage while feeding on blood and liver parenchyma adjacent to the duct. Macerated hepatocytes have been observed inside the sucker and pharynx, leading to erosion of the epithelium, trauma, focal rupture of the duct, and puncture of small blood vessels. The enlargement of the bile duct can be chemically induced, and it has been suggested that the amino acid proline, which is essential for the synthesis of collagen by fibroblasts, is also related in large quantities by the parasite. These two actions exerted by the adult parasites cause a severe eosinophilic and granulomatous inflammatory response, particularly when eggs reach hepatic parenchyma and marked hyperplasia of the bile ducts in which the parasites lodge. Some of the clinical manifestations of fasciola is the abdominal pain in the right upper quadrant, nausea, vomiting, skin rash, obstructive jaundice, cholangitis, and hypereosinophilia. The fasciola life cycle passes through 5 main phases. First, the egg, miracidium, ceraceae, metaceraceae, and adult fluke. As shown in the video, the eggs will be passed in the feces of the mammalian hosts. However, if they enter the fresh water, the eggs will then hatch into miracidia, and miracidia are free-swimming. So this miracidia then infects the gastropod intermediate hosts and develop into ceraceae, which interrupts from the body of the snail host, as shown in the diagram on the presentation, and then it will find and attach to aquatic plants. The ceraceae then develops into metaceraceal cysts. When these cysts are ingested along with the aquatic plants by a mammalian host, they mature into adult flukes and migrate to the bile ducts. Interesting fact, the adults can live for 5 to 10 years in a mammalian host. So basically this diagram summarizes the whole life cycle of the fasciola, first beginning from it passing through the feces of mammalian host and ending by migrating to the bile ducts. So for the laboratory diagnosis, the first one is CBC count. So in CBC count, we find the eosinophilia and history of ingestion of watercress or freshwater plants in a symptomatic individual, which can be a good guide for further testings for fasciolysis. The second one is erythrocyte sedimentation rate. It has been shown that more than half of the people affected with fasciolysis has elevated erythrocyte sedimentation rate. The third one is liver function test. In liver function test, the elevated levels of gamma glutamyl transpeptidase and alkaline phosphatase and bilirubin may suggest cholestatic liver injury. Moving on to the fourth one, which is the stool examination for ova and parasites. So in stool examination for ova and parasites, what happens is that the detection for fasciolitid eggs in the stool in the infected patients is the most definitive test for diagnosis. The fifth one is antibody detection. In antibody detection, it's useful for acute phase of infection, as the acute manifestation of human fasciolysis may precede the appearance of eggs in the stool by several weeks. The last one is the polymerase chain reaction assay. In polymerase chain reaction assay, it has been developed to be a rapid diagnosis of fasciolysis. Furthermore, for the treatment of fasciolysis, the first one is triclobendazole. So in triclobendazole, it's a benzimidazole derivative, which has become the drug of choice for the treatment of fasciolysis. It is recommended by the WHO. And the second one, which is if the first one is not available, the second option that is given as a treatment is nitazoxanide. So in nitazoxanide, this is a good alternative to triclobendazole, which especially in the chronic stage of infection, so what is given is 500 mg twice a day for 7 days in adults. Now, to conclude this presentation, the last thing is the prevention or control measures that is taken. So to avoid fasciola infection, first you should not eat raw watercress and other freshwater plants, especially from areas where livestock feed on land covered by grass, in places where fasciola infection occurs. And the last one, it's mostly important to avoid areas with poor sanitization that can have contaminated food and water. So these are the references that was used in compiling this presentation. If there is any doubt or anything, please do refer to the references. Thank you for watching.